Inspiring Island Women is brought to you by Pine Lighting Victoria. Eliminate the possibilities.
Well, next week is National Nurses Week, so there's no better time to feature one of our hard-working nurses from right here on Vancouver Island. Sarah Lawson works at Victoria's Royal Jubilee Hospital, and she's been instrumental in making her ward better for patients and colleagues alike. Sarah Lawson is this week's Inspiring Island Woman. They say the cream rises to the top, and if you're at the top on the 7th floor of the North Tower at Royal Jubilee Hospital, you'll find one of the best nurses there is.
And then, did you get a chance to take a look at...
Sarah Lawson is a clinical nurse leader who was considering becoming a doctor, but she loved working with patients so much that she changed her mind.
Haven't looked back. It's been really a great opportunity.
Sarah's been working here since 2014. She's a post-op nurse, but she does so much more.
I've worked in the educator role, I've worked as a clinical manager, and I've also worked lots on the floor. Setting up.
Kristen Campbell has worked with Sarah on 7 North for the last 10 years.
She's amazing. She's so supportive to our staff. I really enjoy working with her. She brings a sense of humor to the kind of gloomy days.
Hey, it's Sarah from 7 North.
A big part of what she does is tracking patients and making sure they're all getting the best possible care.
I get in, make sure that, we have enough staff on the unit for the day,
which is you say it like it's easy, but it's
no,
probably not always
that's
easy.
my biggest challenge of the day, is making sure the ward is staffed.
Even though it's tough sometimes, Sarah says it's so much better than it was.
It was much more of a crisis for the surgical program 2 years ago. After COVID, people were leaving acute care faster than they were joining it, and then the needs of our community were going up. We started to see burnout and people leaving, so we had to rebuild.
And rebuild they did, bit by bit. Sarah helping to expand programs to support student nurses, allowing them to work on the unit before graduation, and with Kristen offering even more.
We decided to help support them in their learning, so we put on a 3-hour class for them and help them kind of learn our services that we have and what our unit looks like. And so yeah, we started that, and we've had amazing feedback from that.
And Sarah, a busy mother of 2, also recognized that scheduling, often established as much as a year in advance, had to change.
People have got lives outside of here, and I think that being responsive to that and being able to offer some flexibility has actually attracted a lot of nurses to come work here.
So things have improved here in recent years, but there is still work to be done.
Right now we have too many patients and not enough nurses, but we also don't have enough space. Nobody wants to look after somebody in a hallway space or an overcapacity area, but we just can't turn people away.
Nursing is hard, but it's also extremely rewarding, says Sarah, and the strides they've made here to make the work and the workplace better is having a significant impact.
A lot of the work that was done on the 7th floor over the past couple of years is being mirrored elsewhere in the hospital. And so I think that if we can implement and we can hang on to some of the changes that we've put into place, it's going to make a big difference for care here on the island.
Making a difference. That's what Sarah's doing in the lives of her patients and her co-workers every single day.